the Dementia Researcher podcast, talking careers, research, conference highlights, and so much more.
Hello and welcome to the Dementia Researcher podcast. This week we've been in Montreal to get all the updates on the latest MND research. So stay tuned to get our highlights from this incredible event. Hi, I'm Dr Alys Griffiths. I'm a Senior Research Fellow at the University of Sheffield, and it's a pleasure to be back guest hosting this podcast again. So a few people would disagree that the key to defeating ALS lies in fostering strong collaboration between leading researchers around the world and sharing new understanding of this disease as rapidly as we can. So this was the MND Association's rationale behind the creation of the International Symposium on ALS, which this year has been taking place over the past few days here in Montreal in Canada. So joining me on the podcast today, we have three brilliant researchers who specialise in different aspects of this field. And together we're going to share and look at some of our highlights from the symposium over the past few days. So let's get on with some introductions. Joining me, we have Dr Megan Fowler from Flinders University in Adelaide, Australia, Professor Eneida Mioshi from University of East Anglia in the UK, and Dr Ahmad Al Khleifat from King's College London, also in the UK. So hi everybody, why don't you start by properly introducing yourselves. Megan, are you happy to go first?
Absolutely. My name's Megan. I am a postdoctoral researcher at Flinders University. I only recently finished my PhD, so I've only been researching as a research associate for 6 months. But following on from some of the work that I did in my PhD, so I'm in the same lab. My research focus is looking at endogenous retroviruses and their involvement in the cause and progression of motor neuron disease. And we're also looking to see if we can target endogenous retroviruses with therapeutics, so using antiretrovirals or antisense oligonucleotides.
Great, thank you. Eneida.
I'm Eneida Mioshi. I'm based in Norwich. I've been in the field for quite a few years. My interest really lies into the spectrum between motor neuron disease and fronto-temporal dementia. So really looking at cognitive and behavioral symptoms and how people manage that or need better management.
Great, thank you. And Ahmad.
Hi, I'm Ahmad. I'm group leader at King's College London, and my group is focused on optimizing clinical trials and drug discovery. We try to make trials faster, better, and more effective, and using genomics and also big data approaches and AI.
Fantastic, thank you. So three very different areas within the MND world. So Megan, you presented a poster.
I did.
Would you like to tell us a bit about that, please?
Of course. My poster was looking at endogenous retroviruses in an in vitro model. So I wanted to try and find a cell model that we can then use to be testing therapeutics targeting endogenous retroviruses. So I looked in some common cell lines that were used in the lab and then used exogenous viral infection to induce HERVK expression so that we can then increase expression of HERVK to then be able to target and see if we can find any therapeutics that will reduce HERVK. So we have found one cell model, and it is induced by this exogenous viral infection that we will then be taking to the next step. So I haven't got that data yet, but so far it's just sort of been focusing on validating, finding a good model for HERVK expression and targeting.
Great, and did you get much interest, many questions?
I did actually, yeah. So the previous years that I've been here, I have looked at HERVK before, but I was previously doing it in a mouse model. This year, moving to the in vitro model, and this what I presented this year, I've had a lot more interest in it, which is really surprising. Pretty much the whole poster session that I presented, I had people coming up and talking to me, and I feel like the endogenous retrovirus space is an emerging field, and it is also a little bit of a controversial field, and I feel like not everybody necessarily agrees that it is associated with MND. So I think that sort of gets a little bit of interest, and I think the data speaks for itself, but that's a different story. But yeah, I was able to talk to a few people for quite a long time and start some collaborations, which was really good.
Fantastic. And internationally?
Yeah, absolutely. Yeah, so everyone I talked to was either from America or the UK, so it was, amazing to sort of...
Well, I look forward to hearing more about that next year. Great. And Eneida, you chaired a session.
Yes, I did. I chaired the session on cognitive and behavioral change, which is where we discuss lots of presentations, 7 presentations actually, from different parts of the world. Really good community, because over the years, I think you can see the growth of number of studies that now address cognitive and behavioral symptoms, both in the oral but also the poster sessions. So it's really nice to see there's a number of groups looking into more detail, the application of the Strong criteria when people are classified. So that's really important. Professor Strong was here, so it was really lovely. And I think also the other change I've noticed is that I think the sport in the program, we've been upgraded. So yeah, I think it's really a reflection of how everybody is more aware and more interested, and hopefully we'll be able to make some changes in how people are looked after.
Yeah. So is that the first time that there's been a kind of FTD full?
No, not really. I think it was already a few years ago that there was a session. There have been a few sessions where they have ALS FTD together, and I was reflecting on that, and I noticed this time the title is not FTD in general, but there's FTD throughout so many sessions. So you will see in the genetics, in the pathology, in the clinical. So I think this is perhaps the evolution, that it is more spread rather than needing to have one session with the name. Having said that, last year we did have a session was specific for ALS FTD, but I think there'll be perhaps a bit of a change depending on the year. But I think this is just great. That's more awareness, and more understanding. Yeah.
So appearing in more places because people are just considering it within their larger projects.
Exactly. And more people from the FTD world also attending the ALS meeting, which I think it's really important, isn't it?
Yeah, fantastic. Thank you. Ahmad, what have you been up to?
Yeah, quite a lot, but I think the main presentation like that is part of Project Mine, which is the biggest genomic consortium in the world focused on ALS. And my part is involved in diversifying research in ALS. So we try to understand how people from different ethnicities face ALS in different ways. So that would help us also discover new genes, develop new methodologies around that. With every gene we discover, it becomes harder to find a new gene. So we require different approaches. So far, 98% of whole genome sequence has been done on people with European ancestry. So far, we've been reaching out to other countries, clinicians from all over the world, and the feedback is fantastic. So we started some work in Africa and also in India, also in Central America. Very exciting. Recently, we done some Middle Eastern also work. Part of Kuwait and also in Turkey. We see some new genes or genes that not frequently reported in areas in different ethnicity. For example, C9 used to be the most frequent gene, but we don't see C9 in these ethnicities. We see different genes. So it's really exciting.
Yeah. Sounds like very exciting and important work that you're doing. And so you talked about kind of diversifying clinical trials. And so what are the main kind of challenges in that space?
Trials or genomics in general, because it's two important aspects. It would be fantastic to see also some diversity in clinical trial. We're trying to also make sure that a male and female are represented in good way on these trials, and also different ethnicities. It's really hard also to bring trials to different countries. The cost is quite high, but in general, genome recruitment, it's a lot. There are different challenges. Every country have different rules, and we have to respect these rules. Sometimes we need to do it locally because blood can't be shipped to the main center. So we extract DNA, then we ship it, or we provide support locally to the group there. Most importantly, the diversity is not in data, not limited to data. It's also foreign researchers also. So we try to support researchers all over the world so they can also develop their skills, create groups, take their own research to the next stage. And I think this is crucial.
Oh, can I ask a question? Actually, reflecting on you saying sometimes, the samples will be shipped back to the main center, but shouldn't it be that there's an element of capacity of development for researchers in the country so that there's no need to ship anymore in future?
I think it's the cost. Sequencing. To be frank, we don't have these even tools at our main centers. So we outsource this kind of tool. For example, we had a good collaboration with Illumina, the biggest sequencer in the world. So that kind of partnership is cost effective and also minimize the bias.
Understand.
So sequencing machines are really expensive, as you know. So it's not realistic to have sequencing machine in every center. So I think outsourcing that would be like a potential solution for MD Fresh. But we need to also sequence sometimes locally. So, for example, like in India, this is our approach where we are aiming to help in this way.
That'd be great.
Yeah.
Great, thank you. So we'll move on to some highlights from the symposium. So for anyone who is new to the Highlights podcast, let me start by saying that, of course, we're not going to be able to cover everything that's been discussed over the past 3 days. There's been hundreds of talks and posters, so it just wouldn't be possible to cover everything. But what we're going to do is hear from everybody about the talks that they've seen and the posters that they've viewed that they enjoyed the most. And we'll have a little chat about those together. So Megan, can we come to you first?
Absolutely. I think one of the main sort of themes that I've taken away from this is that there seems to have been a shift from a real focus on TDP-43. I feel like the last few years, at least since I've been coming, that there's always been a TDP-43 session and everyone's sort of focusing on that cell biology. And I feel like this conference has been a little bit different, and there seems to be sort of more of a diverse range of talks, which has been really interesting to hear, that a lot of them have been outside of my area of research, but it's still been really interesting to get all of these sort of other understanding of other fields of research in ALS, which is really cool. That's obviously not a specific talk that I'm talking about, but just overall. And the charm and the flavour. Exactly. And as you mentioned before, it sort of seems like there's more of the focus of the ALS subtypes as opposed to just everyone having a sort of broad understanding of ALS. It's sort of now ALS and FTD, and even within that, then the further subtyping of ALS patients, which has been cool. Obviously, it makes it more difficult for clinical trials and all that sort of stuff, but I think that we're starting to see that real specificity of different ALS subtypes and how we can potentially move towards treatments and cures and that sort of stuff. So,
great, thank you. Eneida, you've helpfully brought the programme with you.
I think there's so many interesting things, as you said yourself, but I think I'm going to highlight one from this morning because I am really an applied researcher, so I think we have to wave the flag there. So for the session with this interdisciplinary care today, Sean White from the UK, he's a dietitian, so he was presenting on one of his PhD studies, and it's really about how the MDTs, the multidisciplinary teams, helped support people with MND making decisions about gastrostomy or not. And it's really quite complex. And I think the key message, which, I think it's one challenge that we have for so many decision-making clinical therapies, is that the way the professionals approach is not necessarily the way the families affected want the approach to be. So professionals have this intention to be proactive and let's get early, let's try to prevent crisis. Because they've seen so many, before, whereas the family says, well, why do I need to talk about this? It's not even our horizon yet. And I think his key message was, you need to ask permission first if the family, the patient, they want to discuss that. So there's so many things the profession could be discussing, and there's so many priorities, but maybe be guided by what the patient, what the family would like to go. And just checking the permission, and if it's there, then go into these complex decisions. But I think what is really invigorating is having more like health professionals present here, showing their research, and I think this is really important for the symposium, and I'm so delighted.
Yeah, so I'm biased because I'm from the same research group as Sean, but I also thought that was fantastic. And I guess, that kind of patient-focused approach of helping us to think about what the person and the family wants, and not assuming that based on our experience that they know us, right?
And that also could be part of optimizing trials, because these outcomes optimizing these soft outcomes with help of people with MND, I think it's really crucial. So it's really hard to measure sometimes what's good treatment is, but quality of life is important. It's not just survival. That we need to work closely with everyone and to make sure that that could be delivered in a better way.
Exactly. Sometimes I guess the question is for them, is it about longevity or the quality, isn't it? And families have to participate in that decision.
Yeah, around quality versus quantity of life and how that might change over time. Great. Ahmad, would you like to give us a highlight for you?
The highlight is the launch of the Longitude Prize, in the initial opening ceremony. I think it was a fantastic idea that to bring large data sets, open these large data sets for everyone, and also create support system to make people, data scientists, geneticists, work with biologists for drug discovery, and bringing this as a consortium in a slightly competitive way, almost like a 5 years hackathon style. Who gonna deliver the first the drug to clinical trial? The winner, being proposed like £1 million, and that's really exciting. Longitude Prize had long history, and I think the main idea was it was open this data set to everyone and see who can help. So we can't say that we are the custodian of this data set or we are the best statistician. Once you open this data set to everyone, you don't know what you're going to find. And I think this is fantastic. Science is about working in a collaborative way, and I think this is the way forward.
Yeah. So that feels something that's quite new in this kind of space.
We do a lot of collaboration between data science, but I think working geneticists or bioinformaticians usually work in isolation from the biologists. And I think this is a combination of both. So first phase is data science heavy. The second phase is validation using in vivo and vitro style. So I think this is the unique aspect. The second unique aspect using AI and cutting edge methodology in drug discovery. And I think it ticks the boxes from using novel methods and also data sharing. And I think it's a logical next step, but providing funding for this is crucial. Yeah.
So bringing people together from hopefully around the world to find.
Although it's UK, it started from UK and it's international also an initiative. Yeah.
Yep, fantastic. So Megan, coming back to you. So another highlight that you'd like to share?
Yeah, there was one talk that I saw yesterday afternoon. I think her name was Stephanie Howe from University of Queensland. And just after saying before that there hasn't been as much focus on TDP43, this one was looking at spatial transcriptomics in a TDP43 mouse model, which is really interesting. And on that sort of collaborative effort, at the end she mentioned that she's hoping to create this application where you can plug in your protein of interest and then it will sort of come up with like a map of how that relates to what she's found as well, which I think is really cool because that's sort of opening up that collaborative effort, and we can all sort of have the same tools to get to the same point, if that makes sense. So that one was really interesting, and she was also a PhD student, so I think that's an amazing effort to get up and talk. It's a PhD student should do well, so yeah, absolutely.
So it feels like a big open science kind of underpinning of all things that people are talking about.
Absolutely. I feel like for a disease like ALS, where there's just so much complexity, that is probably how it's going to be, we're going to be finding the treatments.
Great, thank you. Eneida, have you got another highlight in that program?
I think it's related to actually things you both have said. So this was Cassandra Haddad. She's a gene carrier, and she was on the session on pre-symptomatic detection and early diagnosis. And she spoke as a gene carrier, but she's also a nurse in her job, and she was sharing, the challenges, trying to participate in trials, how, the personal cost. And she was very brave in sharing how actually hard it is. She was very personal too, but so passionate. And I met all the, how they called, the patient...
Oh, the patient fellows.
That's it.
Yeah.
I've met a few more. So I spoke to Mindy as well. I spoke to Paul and her husband Matthew. And it was really interesting because them being here and the types of questions they make, I think it's fantastic because they have, the courage to go and say what they're really thinking and challenging the researchers, but also at the same time contributing and making sure we stay, tuned to what is important. And of course, I need to put a little flag for Sue Hill, who came with me. So she's a former carer. She's also been very much involved in our research. This is the first time she joined to see how the research community is and how the work is going. And, comparing her personal experience 20 years ago and seeing now how FTD is pervasive. So I think having people like that present together with the scientists, it's what makes things meaningful, I think.
I think Cassandra have been doing really fantastic work, and all research fellows. So part of UK MND Institute, research fellow actually are we're the driving force to creating all this collaborative work to create the institute. So and now they are part of also in the committee. So grant are reviewed also by patient fellows.
Yeah.
We provide feedback, and I think this is really critical, like to start from the beginning rather than feedback towards the end of finishing the studies.
Yeah.
And back to what Cassandra was highlighting also about prevention and pre-symptomatic ALS, and I think we need to develop method of how we could communicate science in a more effective way, reaching out, receiving this feedback, and involving everyone in this, because prevention is probably our only solution, or like a good solution to start with.
Yeah, very good.
And I think it's really interesting how researchers need to ensure that their messages are able to be understood by a wide range of audience members here, which includes people living with ALS, family members, researchers from that area, and also researchers who work in completely different areas. So it feels like a challenge, but one that people have very much taken on, and that's led to them having lots of different types of questions. I don't know if anybody was at the breakfast session yesterday, but there was a man who talked about his diagnosis experience, and that for me was probably the highlight, because he talked about how he had symptoms, but actually he was 38 and his symptoms were related to his hobby. So he was noticing that he wasn't making the progression in weightlifting that he would expect, but actually from a kind of healthcare professional, it's not something that would be picked up because his lower limbs weren't affected. He was walking well, but actually it was his kind of grip strength and forearms that were affected. And he was noticing it because he was doing so many bicep curls. But it wouldn't necessarily be picked up, and it wasn't coming up on the scans.
So young as well.
Yeah. And he just gave, I guess, a really powerful kind of message around, if healthcare professionals aren't listening to you, and something is wrong with your body, just keep pushing it. So it felt like a really quite an emotional talk. But just as you said about the other person, so brave to be willing to get up in front of all of these strangers to talk about your personal experiences.
Yeah, I think it's important, for researchers also, to meet people with the MND. And I think one approach we've done at King's, that new PhD students, new researchers will attend the clinic. So we'll show the clinician. And you can see variation and also progression in the clinic from new diagnosis to this is very important, because when you're studying complex condition, it's very heterogeneous. Like you mentioned, sometimes we'll start it's not usually the gait and movement. Usually, sometimes a simple task like holding keys, dropping. So where it starts is really important. That could lead us to understand risk in different ways, and also having male and female build different, also a clinical picture. I think centers should adapt that, like more like active engagement with people with MND from the beginning. Yeah.
I think the charity, both MND Association and MND Scotland, they have events where they are bringing together to encourage PhD students and others to present and also meet people affected by MND. And I think the MND Association one is called Encourage.
Yeah, it is.
And honestly, they are really fantastic, and they are personally friends. Like talking with them, doing.
It's real, doesn't it?
Yeah. I think don't be shy, just reach out.
Yeah, and I think maybe that that way of working isn't known around the world, and that's something that we should be ensuring that we share more widely.
Absolutely. I think in other countries, I come from South America, and I think the relationship, it's still evolving, but I think there's this professional authority versus the patient or the scientist and, the research participant, whereas in the UK, definitely it's very blurred, and there's a bigger push in ensuring that those affected are actually having a voice in grant making, in designing, in how methods are applied, how long things are, how fatigued people may be, and how to communicate the findings.
I think we could learn a lot, and we should be humble because we can't progress. And also that stereotypical image of doctor that knows everything is gone. But we shouldn't be shy, like to search and communicate and admit where we failed. No.
Great. So has anybody got one last highlight before we wrap up?
I have this is more specific to my work, but I thought the whole session on antisense oligonucleotides was really cool. So I think this might be the first year where they've had a whole session dedicated to that therapy, and I thought that was really interesting. I don't know if you guys remember from last year, but there was the antisense oligonucleotide therapy targeting fuzz that was used in N of 1 study where the patient actually walked onto stage at the end of the conference last year, and I thought that was amazing. Like seeing that, I thought that was really cool, and so that was sort of followed up on in that session this year. And it was just cool to see that that patient is still progressing in a positive way, which is really cool. And obviously, this is a bit biased towards my work. I'm going into the antisense space, so it was really interesting to get some of those more molecular understanding of the AOs and how they're working in these studies at the moment.
I think you've raised something really important there. They're around kind of continuity and kind of you hear so much information when you're here, when you hear from kind of individual patient fellows and carers and people living with MND who are sharing their experiences, and then you might never see them again. But actually being able to have that continuation and hearing about them,
for sure,
is really special.
Absolutely, it was cool.
Thank you. Eneida, one last highlight?
Yeah, I think I'm good.
You all out of highlights. Great. Ahmad, anything final?
Probably I saw biomarker work, and I love the idea of different proteins also involved in ALS, and like you mentioned also TDP43 is very important, but we see also different genes, different proteins involved, and which can cause different conditions. So how one gene can cause different also condition and why that I think. We saw some good work in biomarker, like how to connect some of these dots together. Yeah.
So you feel like people from around the world are kind of doing bits of different dots, and then here you're able to start joining them together.
Absolutely.
Yeah, standing outside of the here as to where we are in the.
I think this is the idea. It's not just seeing, also communicating. So now I know she works in retroviruses. I work also on retroviruses.
So we forming connections on the podcast.
At Cairns, we managed to reach phase 3 clinical trial for anti-retroviruses.
Oh, amazing.
So we are doing this also collaboration with Australia.
Yeah. Oh, is that with the Lighthouse trial?
Yeah. So it was actually the connection with retrovirus discovered that case by Ahmad Al Khleifat probably 12 or 15 years ago. And that was really controversial. But seeing it reaching clinical trial phase 3, fantastic. And we'll try to develop biomarker for this. So maybe we could reach out.
Look, patriotic postdoctoral visit. For sure.
Fantastic.
Thank you all so much. So sadly, that's all we have time for today. However, if you'd like to see more from this event, there are lots of posts on social media. Take a look at hashtag ALS MND Symposium on both X and Blue Sky. And you can also visit the event website, which is symposium.mndassociation.org. I would just like to say thank you to my brilliant guests, so Megan, Eneida and Ahmad, and of course the MND Association for making all of this possible. My name's Alice, and you've been listening to the Dementia Research Podcast.
The Dementia Researcher podcast was brought to you by University College London with generous funding from the UK National Institute for Health Research, Alzheimer's Research UK, Alzheimer's Society, Alzheimer's Association, and Race Against Dementia. Please subscribe, leave us a review, and register on our website for full access to all our great resources. dementiaresearcher.nihr.ac.uk